fellow and program head of universalization of education at National Law School of India, University of Bangalore, which is a very prestigious university. And prior to joining the Center for the Child and the Law at NLSIU in 2003, he has worked extensively in terms of influencing the policy making at the Karnataka government. And he's also joined as a co-researcher with UNESCO and Action Aid International of India, contributing to a policy paper on fundamental rights of education. It is known as RTE. You may have heard extensively on this. So he's the lead contributor to that, and he has organized many conferences, meetings in terms of bringing awareness to RTE. He has a number of publication articles and various newspaper and academic journals, books, reports on this RTE specifically. Recently, he's working on the mobilization of SDMCs, essentially the School Development Monitoring Committee, which to take care of the local schools, and the community mobilization in terms of getting these schools work properly in every part of the country. So his study is supported by National University of Educational Planning and Administration, New Delhi. Thank you very much, Dr. Aradhya. Really,
thank you. It's a pleasure. It's a pleasure.
We are really proud to have you, privileged to have you. Just a brief introduction to OSAAT. OSAAT mainly focuses on rebuilding infrastructure, mostly in rural schools. The idea is to make sure that every child gets what it deserves especially in the rural areas. And we partner with NGOs and partners to cut costs to achieve optimal results. We have registered as a non-profit both in the US and India. Started with NRIs in 1999. And then we've done about 36 schools across India, as you can see. We have many schools coming up as well. Which is, in fact, now we came to grinding halt because of the current situation. So overall objective of this webinar is to kind of give an overview of what is happening in the public education system as is, and what is the state of public education post COVID-19, and what remedies that we can do to address these COVID-19 impact, and roles of NGOs in terms of tackling short-term and long-term impact. Just some webinar modalities. All participants are muted so that we avoid cross-talking and unintended interferences. Participant can post your questions in QA, and our moderators will read out the questions, and the speaker will answer at the end. We will also be posting the video on our website so that you can share it with your friends and academics. Please do send your comments and feedback through our website. So with that, we are three of us who are moderating this. My name is Vadiraj Bhatt. I'm founder and managing trustee of OSAAT. Sudhir is the volunteer and the webmaster, who's another moderator, and Prasad HR is our chief partner relations and government interactions. We also have Naren K, who's the treasurer of US, who is also a host. That will end my talk. I will pass the ball to Dr. Aradhya, who will start the session. So the first question, sir, you have been in this education field for much longer than any of us. Can you kind of paint a picture on what is the education scenario as is now, and what challenges that we have from your perspective?
Yeah, certainly. When we talk about education system, India got one of the very biggest education system in the world. Of course, after China, ours is the biggest education system. And if you look at in terms of number, we have almost kind of 1.5 million schools. It includes both kind of government. So India is one of the very biggest education system, particularly in terms of public education, and government is one of the biggest provider of public education. We have about 1.5 million schools and roughly about 9.4 million teachers who are working, in the country, and we have almost about 24 to 47 billion, that is roughly about 24/7, crore children across the different stages, primary, secondary, and higher secondary education. And if you look at in terms of enrollment, our enrollment, in primary stage is almost about 6.2 million. So this is like in terms of boys and girls have given the breakups. What really the enrollment to different stages, like upper primary, secondary, and higher secondary, which covers the entire school education. And when we come to Karnataka, Karnataka has also kind of a big system where we have a government aided, unaided, and of course the central government schools. Roughly, like all together, if you take primary in India is from class 1 to class 5, where we have around 25,236 lower primary schools, and the state share is around 84.6. In the sense, in terms of primary education provider, state is the biggest kind of provider of primary education. It's so with the higher primary education also, our share is almost about 71.4, like most put together, government aided, and all other social welfare department schools. Even put together elementary education, both primary and higher primary education, we are almost providing 77% of the total primary education through government institutions, through government schools. This is also kind of in terms of high school, we are almost kind of more than 70%. I think this is where exactly the Karnataka in terms of schools, each school, see, I was just given basically to understand things better, why we are concentrating on the public education system. If you look at the first column, that is the number of children who are in government schools, you can see that if you look at general population is very less in case of government schools, where in case of private and other schools it is kind of comparatively more. But when it comes to OBC, when it comes to scheduled caste, scheduled tribes, and minorities, I think the government school has the biggest number. So therefore, I see government schools are basically catering to the most marginalized, most vulnerable, and children who are coming from a completely a different community, marginalized community, disadvantaged and economically weaker sections. Therefore, strengthening public education becomes kind of a very important and a priority area for all of us. So this is where kind of in terms of number their discussion. One of the biggest problem that the public education was facing was infrastructure. Infrastructure, when I say the functional infrastructure in terms of classrooms, in terms of functional toilets, in terms of basic, kind of facilities like library, playground, all these things, it was a big challenge even post-COVID, even before, this pandemic, before COVID. So if you look at even the number in Karnataka, out of 52,000 rooms where, the total room available at the lower primary, the functional ones are only 34,000. Nearly 17,000 rooms are not, available for classroom transactions. And if this number increases when you go up, if you look at higher primary, the available rooms is roughly about 150,000, and nearly 1/3 of these classrooms are not, functional or not available for classroom transactions. So this was the situation. This was the situation even before, COVID-19. And if we look at some other issues, the major issues which were really bothering school education in India, not only, after COVID, but even before COVID, nearly for about 30, 40 years. We can say that nutritious food and cleanliness was always a big challenge in the public education. Whatever the midday meal that we are providing for children needs lot of, improvement. We need to enhance the quality in terms of nutrition, and of course enabling learning environment for quality education and quality classroom transaction is another issue, always bothering the public education system. And all of us know there are no subject-wise, grade-wise teachers. Even if I say, if you take lower primary schools from class 1 to class 5, where we have 5 classes and roughly teach about 21 subjects, most of the schools only 2 teachers are available. So that is the state even today, and it was even before COVID. So excessive non-teaching work for teachers, which is really a big issue, not only in Karnataka, all over the country. In fact, major studies have been conducted and its impact on learning process. Lack of coordination between SDMC and teachers. All of us know that SDMC is a legitimate body under the Right to Education Act, and they are completely responsible for managing the schools. So many a times there is a lack of coordination, lack of things, and of course teachers' attitude and values are also equally important. Like how do we really engage ourselves to transform government schools into a functional schools, so that all children, education being a fundamental right, can receive. So just to conclude, like really the challenges even COVID, one can say that the government schools are basically for the people who are in acute poverty, who are struggling on day-to-day for their livelihood, and also it's a between livelihood and providing good quality education. So we need to understand these crises, what we are facing today. It is not just confined to our state or even India. It's a worldwide a problem. If you look at it's really affected 1.57 billion learners across the world. Now, of course, the pandemic has affected almost all sectors. Health, economy, agriculture, transport, industries, business, hospitality, tourism. And what is important, bothering all of us, of course, there are reports available on daily basis. One of the worst affected were the daily workers, wage laborers, agriculture laborers. They were the worst affected. Of course, school education is no exception to this. The magnitude of the COVID impact on school education system, we could see some of these major things, that is impact on school education. One thing that this entire process started affecting school education right from first week of March, like particularly in Karnataka, when cases reported, when deaths reported, a government started taking, a concrete measures. In fact, Karnataka announced its lockdown much before the national lockdown. Our lockdown was on 13th of March, and national lockdown announced from March 21st. As a result of that, all schools, colleges, tertiary institutions, like particularly, all ITIs, diploma colleges, all universities were closed down, and classroom process is completely suspended in all these institutions. And there were many exams which are scheduled, where many of them were cancelled, many of them were postponed. Suppose if I just, give an example, in Karnataka, so far we were not able to conduct examinations for matriculations. That is, 10th standard, which is a very important terminal point at the school education. And we were not able to conduct even exams for first PUC. One of the subject is, still we need to conduct. So it has affected almost about 320 million learners, in which 158 are female and 162 are male learners at the national level. The school education share in the entire, this total number is roughly about 75 million in primary and 133 million in secondary education. So one can see the, the vastness of its impact. how many learners have been completely, kind of really, impacted by this, and what is their anxiety, what is their fear. All these things is also is really, making us, all of us, worry about this. So this is, kind of impact of COVID on a school education system in terms of learners, in terms of, kind of its, overall impact.
If this is the overall impact, I'm sure there must have been major discussions that have been happening in regard to the mitigation plans. It will be very helpful if you could just let us know what are those mitigation plans.
Yes, let us see the mitigation points at two levels. One is what really state is doing, what is state doing, and what really we can think of in terms of mitigating these issues. If I just start with the state response, I could say that state response is more or less kind of a lukewarm, because the reason to say it is lukewarm, because see, the entire focus was on priority sectors like health and economics, not really education sector. Of course, a couple of things were announced as part of the education issue, but the main priority was the economic sector. So as part of midday meals, what really has been done in public schools, ration was distributed. Ration was distributed to children. Of course, the quantity is again, very meager. Take, for example, from class 1 to class 5, we distribute 100 grams of rice and about 50 grams of dal, something like that. So that has been distributed till April 10th. But now, after April 10th, again, there is a lot of demand from the civil society. At least these need to be distributed till 31st March. So therefore, we need to really work for that. So then broad guidelines were issued for private schools, because all of us know that in India as well as in Karnataka, we have good number of private schools. There may be very prestigious schools and also low budget schools. So there were a lot of complaints from the parents that they are, harassing for, fee and other, kind of admission, things. So as part of this, Government of Karnataka has issued series of guidelines not to harass, parents, not to collect fee at this point of time, not to, increase or not to raise fee for this academic year 2020 and 21. Of course, those guidelines. Then, of course, state initiated discussion on online learning. This is one of the important issues that we need to address. Online, when it comes to microscopic minority schools, yes, it is fine, private schools. But when it comes to government schools, online education for the children who are in the public system is a big challenge. So therefore, I think this is not really fully addressed by the state, though they are talking about some kind of modules, but still not yet addressed. Then NCERT is providing a kind of counseling for children, because all of us know during lockdown, children are at home, lot of anxiety, fear, and there are also reported cases of abuse, kind of violence against children. As part of it, NCERT is providing counseling in different regions, south, north, east, west, and also in the central part. This is one good thing from the state, at least to keep children, to address their anxiety and kind of things. And of course, concerned ministers are using various social media, like using phone, Facebook, WhatsApp, to communicate with children, but they were not able to reach all children. This is as a general, kind of communication. There are, kind of at least about 7 to 8 major challenges, I could say. Of course, there are much more than that, but we will just, kind of look into only what really the major challenges, so that we can plan our interventions. We can think of what we can do better, so that let us try to understand what really the major challenges of this pandemic, and how do we address during lockdown, post-lockdown, post-pandemic. So there are different stages: short-term, long-term, and really long-term. Some of the major issues, challenges during this period, if I say, food and nutrition for children will be the top priority. how do we address this issue? Because majority of the children from government schools are basically from very marginalized community. And friends were asking, there were a couple of questions, like in the sense, what is really happening from today onwards, migrated populations, in the sense people who are working in construction area and all these things, they started migrating to their own districts now, because first time the government of Karnataka has given permission for them to move one time, so that they can go back to their districts. So what happened to those children who are migrating with their parents and things like that? So that is one issue that we need to address. And much is said about online education. Friends, all of us know that online education is, yes, it is a supplement to a kind of teaching learning process. It is supplement to the process that what we are doing in school, but it cannot be a substitute. Online education cannot be a substitute for what happens in classroom, because classroom education is more of it's a socialization process. It is mixing each other for empathy and kind of compassion, and also to enable them to develop critical thinking, decision making, creativity. All these things doesn't come through online education. Online education has serious limitations. So people are talking about online education. So we have to contextualize what do we mean when we say online education for children who are there in the public schools. I think that is an issue. Then, of course, even if it is available, online education, it is only for a very small, microscopic minority of private schools, that too very top, prestigious schools. So therefore, what really, the kind of challenge is, already public schools are, kind of in a way, grossly, challenged with inadequate infrastructure, shortage of teachers, or sometimes, only the contract teachers are available, and poor learning process and environment. And when it comes to urban and rural, urban is much more, kind of vulnerable, is much more in a disadvantage, situation, as when we look at the, public schools. So when we talk about online education, forget about they have, access to internet. Even a smartphone is a big challenge for them. So these major, challenges, which really, kind of, there were earlier challenges, there were big challenges even before COVID, and now the COVID, impact has further deteriorated, or, kind of, changed the entire scenario. So how do we address is an issue that we need to, kind of look into. And there is a significant challenge in terms of remote, kind of villages or children, kind of learning. How do we support them? And there are many families where the father and mother are the first generation learners. And of course, if you look at the history of Indian education, for last 50 years, the Indian education system is more or less predicated on children physically attending schools. Whatever that we have done, curriculum framework, infrastructure, all our earlier programs like DPEP, Sarva Shiksha Abhiyan, now Samagra Shiksha Abhiyan, all these programs are designed, thinking that children attend regularly the schools, so that teaching learning process. Now the entire things has been reversed. So how do we address? So this fallout, of ongoing pandemic has a very potential, danger of widening this inequality, segregation, discrimination. So, and also it will really, kind of, widen the learning gap that is existing between rural and urban, within urban public schools and private schools, within private schools, the kind of variety of schools that we have, from international, baccalaureate, ICSE, CBSE. So there is certainly, there will be a, kind of serious challenge. How do we address this gap? So therefore, just to conclude, how do we address these marginalized, children further, being discriminated, whether it is in terms of gender, in terms of poverty, in terms of digital divide, and of course the disability. Children with disability, they are always, vulnerable. They are always vulnerable in terms of their education, in terms of their kind of access to basic infrastructure facilities. So what I could say that these gaps will grow exponentially during this crisis. But it
know that there are huge amount of challenges that are there in front of us post COVID, and you're aware of what is the background behind which many NGOs have been working in the education field, and OSAAT has been focusing a lot on infrastructure. What do you think that in what way that we can support at this point of time? When I say we, I'm referring to the NGOs across and specific to OSAAT also. It will be very helpful if you can just let us know of from your background as to how we can support.
Sure, certainly the state is the primary, kind of provider. They have a primary obligation, education being a fundamental right, and the obligation is on the state. But certainly our role in terms of civil society organizations, in terms of NGOs, and in terms of even community-based organization, the challenge is basically to supplement the state. What all that we can do as NGOs. Certainly, I'm not exaggerating the kind of work that OSAAT is doing, the kind of schools that they have built, so far, has really, kind of created a wonderful, environment, learning environment, provided at least, a kind of a decent, dignified classroom for the poor children. That is one thing that we need to, understand, that the important thing that we have to give dignity for these children who are there in the public education. So if I say this pandemic has no doubt has created unprecedented challenges, and also it has, kind of given a lot of opportunities for us to come together and work together to address this challenge, and also to join hands with the government. So if I just, identify around 4 or 5 issues, the biggest challenge for us, NGOs and civil society organization, what do we do for food and nutrition? Because, majority of the people who are, kind of part of the public education, the parents, they have lost their job. They have not, they have almost come to a standstill. They're not able to get even day-to-day, kind of earnings, day-to-day, to manage their day-to-day, kind of livelihood. So therefore, the first priority for all of us as kind of responsible citizens, whether, kind of we can put pressure on the state to distribute this ration till 31st March. The reason to say till 31st March, because at least till 31st, sorry, not March, till 31st May is vacation is there till 31st May. We don't know, after 31st May, what kind of blueprint that we are going to develop. We may cut down the number of days, or even we may go beyond, kind of May. We may start schools in the month of August, September. We don't know. But at least till that time, distributing this midday, ration under midday meal is an important thing. So how best we can cooperate, how best we can plan that. And what under midday meal is available is only just, rice and dal. Children are not really getting the, nutrition part. So therefore, whether we can pitch in to provide some kind of a nutrition to enhance the quality of nutrition, the quality of, midday meal, what they are getting is another challenge that we can think of. Then use school kitchens. There is possibility, if we are not able to open our schools even after May, let us say June, July, we can think of whether NGOs can pitch in using the school kitchen, to prepare food for children, hot midday meal, so that the food can be supplied to the, home wherever children are, kind of with a parents. So we can think of supplying, hot cooked midday meal, because nothing can substitute that. When it comes to health and safety, of course, it's a very big challenge, because one of the big challenges in India, we are not doing enough testing. Whatever that we are doing is, whenever there are reported cases, that we are, kind of treating them. We have not done, testing on a very massive scale. So first thing that we need to do is we have to create a massive awareness through ICT material, bringing, small booklets in the vernacular language so that children can understand. So that is one area that, basically to understand, because all so far, whatever the government efforts to create awareness is basically towards targeting adults. We have not really targeted children. So children should understand, because once if we start schools, once if they come, start coming together, then they will have a more risk. So we need to make them understand what really the pandemic and how to address, what kind of cautions they need to take. That is one issue that we need to address. How do we prepare that kind of a material for mass communications? And also I am thinking, I was also discussing with Wadi sir, that whether we can open some kind of small centers where we can have random random testing at different levels, whether it is at the block level, cluster level, district level, so that at least we know what really the magnitude, what really the problem, so that like we can take precautionary measures. Distribution of mass, suppose in case if we start schools, certainly if we make children to attend either in shifts or maintaining that physical distance, but somehow they have to wear the mask, somehow they have to use this sanitization. This whole process of cleanliness, hand washing should continue even in school. So we need to provide them basic things like masks, sanitizers, and also whether we can really provide, because I don't know whether really the state is in a position to invest for all these things, because more or less all their coffers is completely already people are talking that whatever budgeted, what was announced in the budget, there may be serious cut in that budget. I take, for example, in Karnataka, roughly about 28,000 crores was allocated for school education. Of course, 90% of it goes for salary. But now there is a fear that they may cut down even that. So therefore, how do we, bring in resources is, an issue that we need. Then special awareness for sanitation in the context of COVID, because we are not really, serious to train children for hand wash. Though we may say that this is one of the best preventive measure, but where do we train? How do we train them? And what really the minimum things that we can provide for them to do that is an issue. Of course, infrastructure, which is is a basic issue. It's a basic issue, that is the issue that well addressed by OSAAT, and of course it requires a lot of resources. Now I can say with confidence, certainly government is not going to invest for infrastructure at this critical period, because now they are already struggling to pay the salaries for teachers, to pay the kind of minimum whatever the expenses in terms of school grant. So therefore infrastructure investment is really a big challenge. So therefore, how do we mobilize resources? How do we bring in whether it is CSR donors or individual public spirited individuals? We need to kind of reach all of them at this critical period. And I think we should continue our work in terms of providing at least minimum infrastructures wherever it is needed. There are many schools which needs infrastructures, functional toilets. And also I was thinking now, since classroom is a very limited space for addressing, whether we can also think of using the outside the classroom premises, build kind of small things where children can sit, maintaining the social distance, so that they can continue their learning, things like that. So that is one area that one can think of as part of the infrastructure. Of course, teaching, learning, and self-instruction is another area that where interventions can be made. Particularly physical attendance is a big challenge, and we are not sure. There is a lot of uncertainty. Still, it is in a very fluid state, and we don't know when we are going to open the school. One of the committee constituted by the Ministry of Human Resource Development said that it is better to open schools and colleges only in the month of September. And imagine if it is September, then we have to kind of manage one quarter, that is June, July, and August. So how do we really address this? So therefore, what I am thinking, whether we can use this mass media, both radio as well as Doordarshan, for kind of learning process. redeploying them, particularly those channels for kind of carrying age kind of appropriate lessons, structured lessons where we can give class wise kind of subject wise things like that. So both, of course, Doordarshan and AI is the only media that is available for the rural poor. Even if you think of smartphone, again the question is how many parents are able to put data pack for the smartphone is again kind of a question when they are struggling for their own survival. Whether we can provide some kind of a support is also an issue. So another important thing that we can revive is India has done very well in terms of satellite program. There was a program called EduSat. EduSat was well utilized, well kind of it was done a wonderful job as part of the Sarva Shiksha Abhiyan. Now there are also a lot of things available in the academic authority, that is SCRTs, State Education Research and Training, NCRT has done. So whether we can really bring back that and what we can do. Of course, particularly radio, whether we can use a community radio, because if you take Karnataka alone, there are 16 centers where we can use at least for all kinds of broadcast, communications, things like that. So this is kind of the challenge before us, and these are the 4 areas that we can kind of think of addressing.
One of the things which probably you can address now, which relates to what you were saying, the pandemic is likely to last 2 years since mass testing as well as vaccine has not been discovered, right?
Yes.
Schools most all over the world are actually going online, and learning is actually a need. So online learning is a need. So do you know how Karnataka government or even schools in India, the government schools especially, are preparing for this along with as a plan B? When you are talking about in the face of reduced budget?
Sir, certainly, yes. The point that what you have raised is very true. Like it may last for next, 1.5 to 2 years. So therefore, how do we plan, prepare plan 1 or plan 2, plan A, plan B? This is really an important thing. But also the question is, what kind of access and infrastructure we have for this online learning is really a fundamental question. When it comes to at least the private schools, they have at least the limited kind of access to gadgets that are required, whether it is a laptop, whether it is a smartphone. But whereas in government schools, we need to depend only on mass communication channels like Doordarshan or All India Radio. Now already academic authorities are working, that is the SCRT, which are working under National Council for Education, Research and Training, which is a national level academic authority. They are planning the syllabus, they are preparing different options. Suppose if you cut down, the kind of syllabus, and if you go for some accelerated learning program, how best we can use this radio as well as Doordarshan. And also people are thinking about how best we can use smartphones so that we can have these WhatsApp groups within the neighborhood wherever schools are located, so that we can bring teachers and students together for day-to-day communications, and teachers can even engage students through small videos related to the content. So these are some of the options available, but still we need to fine-tune this, we need to plan, because when it comes to public education, the biggest challenge is reaching the rural poor. How do we do that? These challenges need to be addressed. I think probably for the next 1 or 2 months, we will be able to get some kind of idea about this.
So Dr. Aradhya, that leads to the next question. Can NGOs like OSAAT, can we pitch in providing like the mass internet kind of communication? Maybe we don't have to provide smart devices for everybody, but using the internet, and if access is available in the school, educate teachers, provide them soft skills training so that they can use internet based resources and online resources is semi-mass. It's like we have internet connectivity. Children can sit in a classroom kind of environment, and teachers can assist in giving them training in segregated groups. So a mix and match of something, is that possible, and is there a role that can be played by NGOs?
Sure. I think this is an important question. When we talk about public education, and particularly involving teachers, the biggest challenge is, basically we have to prepare teachers now. All these years, teachers were using these, online gadgets, whatever, the ICT, they were using it as a supplementary thing, not really as a substitute, not really in a big way. So therefore, the first thing that what we need is we have to train, teachers how to use this, how to, so that they can prepare lessons, how best they can prepare, kind of lessons based on the contents, and how best they can make it as a self-learning materials. So these things are very important, as you said. Of course, what I personally feel, OSAAT, private citizens, CSR, NGOs, like OSAAT, we can at least think of some 4 to 5 important interventions. As I said, of course, I'm emphasizing at this point, supporting nutrition is one of the important thing. What is learning without nutrition when children are in empty stomach? Certainly, whether it is online, whether it is physical one-to-one interactions, is impossible. So what certainly we can do? I'm thinking in a very holistic manner. Not only just online learning. I think we have to start with nutrition for poor children, what best we can do, how best we can mobilize, that is one thing. And help children, parents and community to take, kind of concrete measures, particularly in terms of safety. Suppose, suppose if nothing is, kind of reaching the children, then children are compelled to come to school at least once in a week.
Right. So I think that there was another question, probably your point makes sense. One of the questions was, given the poverty challenges, will parents pull out children and put them in child labor instead of sending them to school? And I think your answer is, if you provide nutrition and other things, quality food, I think your point is it will incentivize children to come to school because they are getting one proper meal in a day or something like that, right?
You're absolutely correct. I think probably to mitigate this, unless we give nutrition support, some kind of a financial scholarship support to these children, it is very difficult to retain those children. I think I see two important developments, as part of this, pandemic. One is children who are there in the private schools, they may get dropped out, in the sense increase in in the number of out of school children, or like child labor may be further maybe increased. But there is also a possibility that children can migrate from private schools to government schools. There is a big possibility, because parents are not really able to pay the kind of fee structure that is in private schools. So therefore they may decide to withdraw children from private schools, and they may put children for public schools. So therefore it is important for the government to prepare a plan for this, to plan in terms of kind of making preparations to receive those children in government schools. Take for example the migrant children I am talking about. So naturally in many schools the enrollment may go up, because most of the migrant workers are moving out of the cities. They are moving towards their rural areas. So naturally it will increase the enrollment, and this is really a great opportunity to strengthen, because a number of schools in public educations are very small schools where we have less than 30-25 children. So this is an opportunity to enhance the enrollment and also welcome children who are coming from private schools, because they are not able to afford that kind of a fees, so that wherever possible government can enhance their seat. There are good schools like Adarsha schools, Navodaya schools, schools run by the residential institutions. There certainly they can increase at least one more section to accommodate those children who are coming from English medium, particularly from private schools. So I think
was in terms of Delhi seems to be doing very well managing education and things. What is it that we can learn from the Delhi model? And is there some best practices that can be implemented other places as well?
So Delhi is both combination of good and bad. Good in terms of their investment is wonderful. They have spent 26% of their budget. 26% of their budget is for school education. Of course, again, when we talk about Delhi, we also look at the number. Like in Delhi, the maximum number of government schools is around 1,200, 1,500. Whereas in Karnataka, the number of schools, elementary schools alone, is 43,000. So I think, like in terms of number, we are kind of a things. Of course, Delhi is doing well in terms of infrastructure. In fact, I visited some of their schools in the last March as part of a high-level delegation from Karnataka. Schools are extremely, kind of good. I think that kind of infrastructure itself brings a kind of dignity for children. Children feel that our schools are really wonderful. That itself give a lot of confidence both for parents as well as for children to attend government schools. So certainly we have to learn that from kind of a Delhi experiment. Of course, their learning process need to be improved. Another important intervention from Delhi is their teacher training. In fact, teachers have been sent to different places, Oxford, Singapore, even Finland, in many places. And as part of motivating them, kind of really preparing them for quality education, which I, in a way, flagged in the earlier, slides, that, motivating children for quality classroom transactions is really an important. So we can certainly follow Delhi, but one thing that we need to learn from Delhi, we need resources for everything.
Sure, sir. So the other question, kind of curiosity question is, do you know from the information you have if schools are being used as quarantine centers? Because that could be again a challenge post-COVID kind of scenario. From what you know, what is the general utilization pattern of school infrastructure or school buildings, especially in rural India? What is your information?
Yes, sir. In many places, schools are used as quarantine centers. In many rural areas, Karnataka, of course, it is less, but in other parts of the country. But in Karnataka also, in many rural areas, schools have been used to, house migrant workers and, people who are, kind of really, kind of, which are in big number, which were not able to transport from one district to another districts. Those people have been, housed in schools. So therefore, the biggest challenge in case if we start school, whether we start school in September or, October, that's a different thing. But the biggest challenge is disinfection. Once if we start the school, the entire school premises need to be disinfected. Because, like we don't know the kind of, presence of this, COVID virus. And therefore, disinfection and providing sanitizers, providing hand wash facilities, this becomes really a big challenge. Once if we start even think of, going for physical, presence of children in the schools. So we have to prepare for that. What kind of mechanisms that we can follow for disinfection now? Right now we are using, some spray, something like that. I think probably the experts can help us in what way that we can, really develop a mechanism to disinfect our schools.
So the other positive thing, at least, I mean, some of the interaction we have had, we are hearing is our rural schools, they have been much protected. I mean, there are not large incidents of infection in rural India, at least the schools that we have contacted, OSAAT has contacted, that's what we are generally hearing. Of course, once the lockdown is lifted, there is always this risk of interaction of urban and rural people spreading the infection. That risk is always there. But even we hear from reports from others, stories we hear where villages have barricaded themselves. They don't allow city folks inside, so which might be a good thing. So do you think there is hope in terms of especially the rural schools where they can live a protected existence? Or do you think once the lockdown is lifted, there could be severe risks?
Sir, my answer is both yes and no, because, like, see, For example, I am just telling today, thousands and thousands of children started moving from cities. Now Bangalore itself, like if you see the report, there were thousands of migrant workers who took bus from Bangalore to different parts of the state. We don't know what really, because we have not tested them. And also the peculiarity of this particular pandemic, at least for 21 30 days, we may not be able to even assess whether they have any infection or something like that. And somebody called me from SDMC from Dakshina Kannada and Udupi, which are the two districts. There are people who are coming from Maharashtra now. Now they have given some kind of permission so that people who are there in Maharashtra can come down. So we don't know, like some of these states like Maharashtra and all, the infection was very high. The kind of things are very high. So they are coming down to Karnataka now. So they are coming down to rural areas. So we can't say, but of course, as it is, as on today, rural areas are better. And of course, if you even look at the green zones are more in rural areas, like unlike red zones like Bangalore, urban, rural, Mysore. So there are, but we can't really take that kind of a risk. So disinfection, sanitizer, mask, and kind of massive awareness goes in a big way as a kind of a protection measure, as a kind of a safety and protection precaution, kind of prevention as a kind of a basic thing. I think we need to take those measures, and it all depends upon which locality, which area, and what possibility of this infection, things like that.
Sure, sir. So we are reaching towards the end of the session, and also if I have missed any questions, please.
I had one question. Someone has asked, actually sent to me, saying that now that there are these opportunities and vacations, can we have the villagers who are the probably first generation education, first generation of learners, or somebody who has possessed good skills? Can we engage that to teach these children instead of waiting for schools to open or something like that, so that to keep them engaged and productive?
You are exactly correct, sir. What we can do is we can make small groups in each kind of area, whether it is a block or a district. We can do a kind of a training of trainers, so that they can go back to their villages, because training all youths or students in the village may be a very big exercise. It becomes a very massive exercise. So if you are able to select some kind of good people, so that they can go back and they can go give training for their own fellow friends, and they can certainly take that process. But this is a good idea, since like till 31st May, more or less schools are kind of closed. So we will reopen if everything goes well in the month of June, first week. And also the bigger challenge for Karnataka now, we have not yet conducted SSLC examination. So there are around 8 lakhs children who are eagerly waiting for what is going to happen for SSLC. In fact, all of us have suggested to conduct examination at the school level, knowing the risk factors, because if they come back to the examination centers and all, it may create a lot of big gathering, around 600 to 800. So I think these issues need to be addressed, but this is certainly a good time to identify volunteers, and we can try.
Good way to teach them sanitation, because somebody has also a question saying that can we kind of ask teachers to help neighborhood in terms of teaching them sanitation and cleanliness. Maybe even these volunteers, the way you have explained in Rajasthan, maybe the similar model to engage them and teach sanitation, because they have to be in the midst of these people, not just walk away in terms of teaching the sanitation and cleanliness.
Yeah. We call them barefoot volunteers. It was in thousands, 10,000, 50. It was a big number. Certainly, we can use both. We can take the help of teachers, SDMCs to identify such kind of volunteers. Anyhow, at least for next 7 to 8 months, we must find ways and means of protecting children, making them learn, and also, kind of addressing the challenges of, livelihood. So therefore, certainly we need them at least for next 1 year, at least in their, own villages, things like that. So this is a wonderful idea. Certainly we can plan together. We can initiate in a couple of places, and we can see how it will work. And later we can replicate in other parts of the state.
So the last question to end this is, what about psychological aspect? I mean, now that children have gone through this, will they be, is there a need to counsel them, and do we have to care? Because there seems to be, I mean, nobody is kind of attending to them. Everybody is now probably frantically looking at the livelihood. Will there be a psychological impact on these children?
Sir, already these issues are surfacing. If you look at the number of calls received by the child line is exclusively meant for children, so that they can call and kind of tell their whatever problems. Childline is receiving almost 130 to 140 calls. We have Childline in almost all districts, in all 34, 30 revenue districts. They are receiving many calls. In fact, I was talking to the chairperson of the Karnataka State Commission for Protection of Children, whether we can have, online, kind of counseling like what NCERT doing. But NCERT doing in a very limited area. It is doing just north, south, and number of counselors are very, very less. I think what we can do is we can associate with the DSCRT, which is the state academic authority. We can certainly learn from NCERT model, what kind of model that they are following for counseling. This counseling is basically address anxiety, fear, and there are reports that there is increasing, violence on children at the domestic level, domestic violence. And also, I am sure that in Karnataka, the child marriage is an increase. At least in the last, 10-15 days, as per the report, there are more than 150 child marriages which was reported in Hindu. So all these things are really on increase. So if we're able to counsel them, counsel children, counsel parents, I think certainly it's going to give us a very good dividend in terms of their, kind of addressing anxiety, addressing, the kind of fear that they have. I think we can certainly associate with DSCRT, since already NCERT has done. Certainly there is a model. We can study that model and we can increase the number. We can increase the number of counselors, and wherever possible, we can use teachers. Teachers are the best counselors, because anyhow, even after post-pandemic, they need to counsel children for various things, because we don't know what is happening within the home now, because it's all like very closed, kind of a thing. Once if the lockdown is over, children may come out with the kind of stories, the kind of, time that they have passed through, the kind of violence, whatever. But it's good to prepare for it.
Wonderful, sir. We have taken quite a lot of your time. It's very, very eye-opening. You have spent quite a lot of time. It is indeed a massive challenge for us. I think all of us, both from the tech world, non-tech world, to look at this constraint as an opportunity to innovate. Obviously, innovation, comes through in such hard times. So you have given us quite a lot of, insight. We thank you for all your amazing work, as well as, your guidance, and most importantly, spending on a weekend to be with us and help us understand what the issue is. We will certainly work with you. Thank you very much. We're going to have more such series. We are also planning to have one for teachers. I think we have heard stories from our side. We also want to hear from the teachers and, kind of understand what they could do, kind of prepare them. Really thank you. In coming days, we will have more such webinars, and sincerely appreciate the fact that you could start this, and hope that it'll become more popular and useful. Thank you very much. And we thank all the audiences. Hope we have all answered your questions. Please send us your comments through our website. And if you have any specific topics that you'd like to cover, and let us know. Thank you very much. Have a great night.
Yeah.
Naren, stop there.
Thank you very much for providing me this platform. to share whatever, because I've been working in the area for last 3 decades, strengthening public education. I think it's a collective effort. You have nicely put it. It's a collective effort, and unless we strengthen public education, we have very, opportunities certainly to educate children who are from the rural areas. So I thank you very much. Let us work together to make a difference during this unprecedented, crisis. Let us help this young India to learn, because they constitute around 1/3 of the total population. So let us work for their, progress, and let us, handhold them during this critical period, and all of us, work together. Thank you very much.